The case the group was given to handle is about the circulatory system and all that concerns it. The group then secured an appointment with Dr. Agapito Fortuno Jr., Doctor of Internal Medicine and Cardiology. The interview was done in the medical city in Ortigas, Pasig City. What is the circulatory system and what is its functions and its basic process?
Okay, sa human body, circulatory, siguro nadaanan nyo na yan. So it's composed of the heart and the blood vessels. No? So it brings, basically, it's an artery and venous system, di ba? And then central to it is the heart. And then so it brings blood to the entire body. So by bringing blood, it brings oxygen, nutrition, and also it carries cells in the blood that fights infection, or it cleanses the body of its waste products also. So in a way, it does a lot of, basically it supplies the entire body with the proper oxygen and parang masustain nyo yung basic process ng every organs. Yun ang basic function ng circulatory system.
What is the difference between the veins and the arteries?
So basically the veins carries non-oxygenated blood. No? The arteries carries oxygenated blood. So of course, how is the blood oxygenated? So it passes through the lungs, and then it goes to the left side of the heart, and then the heart pumps it to the different organs of the body through the arteries. No? Okay, so after that, the venous system takes over, so it drains the organs of the blood, and then it brings the non-oxygenated blood back to the lungs and to the heart.
The circulatory system is comprised of the heart, the blood vessels, and the blood. It consists of two circuits that carry blood around, the smaller being the pulmonary circuit, which runs between the heart and the lungs, and the larger being the systemic circuit, which runs between the heart and the peripheral tissues. The cardiac circulatory system functions by providing the tissues of the body with oxygen and nutrients which are transported in the blood. The pulmonary circuit carries the deoxygenated blood into the lungs, where the exchange of oxygen and carbon dioxide that the body has produced occurs before the blood returns back to the heart. The heart then pumps the newly oxygenated blood around the systemic circuit of the body and delivers the oxygenated blood to the tissues before collecting the deoxygenated blood and sending it back to the heart with unused nutrients and metabolic waste products. These extra substances within the blood filter into the liver for processing. The heart is a muscle that acts as a pump. Through electrostimulation, it beats and pushes the blood around the entire body through the circulatory system. The heart is comprised of 4 chambers that consist of 2 pairs on the left and right sides of the heart. The atria collect blood returning to the heart, while the ventricles pump blood out of the heart. The valves in the heart prevent the backflow of blood into the chambers of the heart. The muscular septum divides up the 2 sections of the heart, creating a left and right side, each containing 1 atrium and 1 ventricle. The right side of the heart pumps deoxygenated blood, and the left side pumps oxygenated blood. There are 3 major classes of blood vessels, namely arteries, veins, and capillaries, and they are categorized according to their histological structure. Arteries transport blood between the tissues and away from the heart and have thick muscular walls with small internal lumina or passageways that can withstand blood under high pressure. Veins carry blood away from the tissues and towards the heart and have thin walls. Their internal lumen is larger than that of the arteries due to the fact that they contain blood under low pressure. They also have valves that prevent the blood from flowing backwards. Lastly, the capillaries, which are found in the muscles and the lungs, are microscopic and have a one-cell layer thick endothelial lining. In other words, the walls of the capillaries have the width of one single epithelial cell. They can only tolerate blood under very low pressure due to the fact that it will move slower and gas exchange has a chance to take place. This is also where the exchange of gases, water, nutrients, and waste products takes place, because the capillary walls are thin and fenestrated. After this, the capillaries collect into venules, which are the equivalent to arterioles and fenestrated. Capillaries connect arterioles and venules. The blood is made up of four major components. The plasma is the fluid that surrounds the blood cells and helps transport carbon dioxide, hormones, and metabolic waste products. Red blood cells, which are also known as erythrocytes, are formed in the bone marrow and function mainly as oxygen carriers. White blood cells, or leukocytes, make up the body's immune system by producing antibodies and helping destroy harmful microorganisms. These cells are also created in the bone marrow. Lastly, platelets are cells that clump together to form blood clots and help protect the body by preventing bleeding.
As a doctor of internal medicine and cardiology, what are the common cases or diseases experienced by your patients?
So most of the patients we have have heart disease, blockage of the artery. They also have hypertension, high blood pressure. So basically, also I have patients with disease of the heart valves. So since I'm a cardiologist, but I also have, as an internist, I also see patients with other diseases like diabetes, also with kidney failure, but that's on the side because patients with heart problems also have, eventually they also have other organ disease like stroke and kidney disease.
What is the most alarming case you have handled?
Alarming? So it's a massive heart attack wherein the patient dies in front of you, with no blood pressure, no heartbeat, so flat line. So siguro you watch medical drama siguro, di ba? So in the emergency room or medical dramas you have. So they know you have some form of action in the ER or in the operating room, wherein the patient loses consciousness, loses all vital functions. So and then also they might high chance of losing the patient, expiring, mamamatay sila.
Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. Two conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fatal. Acute myocardial infarction. Acute myocardial infarction occurs when a portion of the myocardium, heart muscle, dies as a result of oxygen starvation. The dead area can no longer pump. This can lead to cardiac arrest, shock, pulmonary edema, or congestive heart failure. In some cases, heart attack patients suffer cardiac rupture as the dead tissue area of the heart muscle bursts open. Medications called thrombolytics dissolve clots that block coronary arteries. Other patients receive an angioplasty, a balloon device to open the arteries. Aneurysms. Weak spots that dilate are known as aneurysms. When a weakened artery bursts, rapid internal bleeding occurs and tissues beyond the rupture can be damaged. A rupture of an artery within the brain can result in a severe stroke. If a major artery ruptures, death from shock can occur. Arrhythmia. A malfunction of the heart's electrical system will generally result in an arrhythmia. Electrical disturbances within the heart result in arrhythmias, including bradycardia, abnormally slow, less than 60 beats per minute, tachycardia, greater than 100 beats per minute, or rhythms that are present when there is no pulse, including ventricular fibrillation, ventricular tachycardia, pulseless electrical activity, and asystole. Congestive heart failure, CHF. Congestive heart failure, CHF, is a condition of excessive fluid buildup in the lungs and other organs because of inadequate pumping of the heart or a failure of the lungs to function properly. Congestive heart failure can be caused by diseased heart valves, hypertension, or some form of obstructive pulmonary disease. The symptoms of CHF may include tachycardia, shortness of breath, elevated blood pressure, cyanosis, profuse sweating, cool and clammy skin, pulmonary edema, pedal edema, or the coughing up of frothy white or pink sputum. Late signs include engorged pulsating neck veins or enlarged liver and spleen with abdominal distension.
What role does cholesterol play in cardiovascular disease?
Cholesterol. So cholesterol's basically, cholesterol is not entirely bad, but then if it's overproduction of cholesterol and if you have the production or ingestion of the bad cholesterols, it promotes the building up of cholesterol deposits in your arteries. So when cholesterol deposits builds up in your arteries, so the blood flow to an organ through that particular artery is impaired, right? So there's a process of ischemia or lack of oxygen or blood supply to that part of a body or an organ or to the heart, no? Because basically the heart receives its nutrients also coming from an artery. So the blood that it pumps is it is not for its own use only. So it only receives a certain amount through the coronary arteries.
Through your body, your cells use cholesterol as a building material. Over time, a lot of cholesterol can build up inside the walls of your arteries. A buildup of cholesterol causes fatty streaks to form in your arteries. This is part of a process called atherosclerosis, which narrows and stiffens the arteries. The longer the cholesterol sits in the artery walls, the harder it gets. Eventually, a fatty streak can get so large and hard that it cracks, causing a clot to form around the crack. This clot can block the artery, causing a heart attack or stroke.
What role does diabetes play in heart or cardiovascular diseases?
Diabetes promotes atherosclerosis. So if you have high sugar, so the bodily functions is impaired, so you develop high cholesterol also. And with high blood sugar, your arteries, the inner lining of your arteries are, so if these your arteries, the inner lining is like an organ. So the function of it is impaired also for sa diabetics. So you promote atherosclerosis if you have diabetes because you have the function of the lining of the arteries is impaired when you have diabetes, especially uncontrolled diabetes. So it develops into becoming from a clear artery to something like an obstructed artery. So something like that here. So it promotes atherosclerosis, which is the process of developing blocked arteries in your entire circulatory system, most especially in the heart and the brain.
What is the difference between low and high blood pressure? What does high blood pressure have to do with heart and cardiovascular disease? If a patient has high blood pressure, how do they lower it?
I'll say high blood pressure is somebody who have blood pressure of 140 over 90 and above. So that's a definition of high blood pressure, hypertension, resting blood pressure. Yeah. So if you have a high blood pressure, your heart can enlarge, the arteries can weaken. So it may promote also atherosclerosis. It may promote rupture, eventually rupture of the arteries in your brain, in the periphery, and it also enlarges your heart, hypertension, because you pump a lot of pressure just to force blood into your different parts of the organ. So when it pumps blood a lot, your heart becomes enlarged. So hypertension. What's your other question? Low blood pressure. Low blood pressure is something, it depends. Some people can tolerate low blood pressure even below 90. Some people can tolerate blood pressure of 100. They cannot tolerate blood pressure of 100 systolic and below. But basically, anybody who has a blood pressure of 90, below 90 systolic, supposed to have low blood pressure. They lower it by, depends on, initially they try to lose weight, especially for young people or obese. They lose weight, avoid too much salty food, fatty foods, avoid eating too much calories, and then having some physical activity. That is only if your blood pressure is mild to moderate high. But for people who have very high, so having lots of physical activity is counterproductive. We have to give medications already. So for people who cannot lower their blood pressure by diet and exercise alone, especially the older people already, need medication.
What advice would you give, especially po on the lifestyle of Filipinos na pag kumakain po, especially po pag may occasion and marami po talaga.
Don't eat too much. But even hindi lang fatty food, pati carbs, no? So if you eat too much calories, you tend to, you store it in your body, you become bigger, If you become bigger, you may become hypertensive, your weight adds, you may develop diabetes, especially if you are prone to it, especially if you have the genes to develop diabetes. So don't eat too much. Avoid too much eating, avoid what do you call this? Avoid yung eat all you can na restaurants, no? Because then you have a tendency to take a lot of food when you are in that particular restaurant kasi manghihinayang ka, di ba? Pretty soon you get overloaded, di ba? So just take whatever you need. Okay, don't over-ingest. Parang ganun ang buhay. So huwag masyadong anong meron, kukunin mo lahat. So life is like that. Unlike also our politicians, they have already something and they still want to get more. Okay, so just take whatever you need. No?
Can people with low blood pressure still suffer from heart disease?
Yes, so it depends also on your on your genes also, because some people have heart disease. Mind you, have heart disease different. We have a lot of categories for heart disease. So I'm not only talking about heart disease secondary to hypertension or diabetes or atherosclerosis. Some people have heart disease because they have congenital. So meaning to say, life, even after their birth, even during, well, when they're born, they have defects already in their heart. They also have heart disease. So basically, some people, even young ones, right, hindi naman mataba. But you notice that they are suffering from heart disease. Okay? It's a different category of heart disease.
If you lined up all the blood vessels in your body, they'd be 95,000 kilometers long. And every day, they carry the equivalent of over 7,500 liters of blood, though that's actually the same 4 or 5 liters recycled over and over, delivering oxygen and precious nutrients like glucose and amino acids to the body's tissues. All that blood exerts a force on the muscular walls of the blood vessels. That force is called blood pressure, and it rises and falls with the phases of the heartbeat. It's highest during systole, when the heart contracts to force blood through the arteries. This is your systolic blood pressure. When the heart is at rest between beats, blood pressure falls to its lowest value, the diastolic pressure. A typical healthy individual produces a systolic pressure between 90 and 120 millimeters of mercury, and diastolic pressure between 60 and 80. Taken together, a normal reading is a bit less than 120/80. The blood traverses the landscape of the body through the pipes of the circulatory system. In any plumbing system, several things can increase the force on the walls of the pipes: the properties of the fluid, extra fluid, or narrower pipes. So if the blood thickens, a higher pressure is needed to push it, so the heart will pump harder. A high salt diet will lead to a similar result. The salt promotes water retention, and the extra fluid increases the blood volume and blood pressure. And stress, like the fight or flight response, releases hormones like epinephrine and norepinephrine that constrict key vessels, increasing the resistance to flow and raising the pressure upstream. Blood vessels can usually handle these fluctuations easily. Elastic fibers embedded in their walls make them resilient. But if your blood pressure regularly rises above about 140/90, what we call hypertension, and stays there, it can cause serious problems. That's because the extra strain on the arterial wall can produce small tears. When the injured tissue swells up, substances that respond to the inflammation, like white blood cells, collect around the tears. Fat and cholesterol floating in the blood latch on too, eventually building up to form a plaque that stiffens and thickens the inner arterial wall. This condition is called atherosclerosis, and it can have dangerous consequences. If the plaque ruptures, a blood clot forms on top of the tear, clogging the already narrowed pipe. If the clot is big enough, it can completely block the flow of oxygen and nutrients to cells downstream. In vessels that feed the heart, that will cause a heart attack when oxygen-deprived cardiac muscle cells start to die. If the clot cuts off blood flow to the brain, it causes a stroke. Dangerously clogged blood vessels can be widened by a procedure called an angioplasty. There, doctors thread a wire through the vessel to the obstructed site, and then pass a deflated balloon catheter over the wire. When the balloon is inflated, it forces the passageway open again. Sometimes a rigid tube called a stent is placed in the vessel to help hold it open, letting the blood flow freely to replenish the oxygen-starved cells downstream. Staying flexible under pressure is a tough job for arteries. The fluid they pump is composed of substances that can get sticky and clog them. And your typical healthy heart beats about 70 times a minute, and at least 2.5 billion times during an average lifetime. That may sound like an insurmountable amount of pressure, but don't worry, your arteries are well suited for the challenge.
What risk factors should be strictly controlled after experiencing a heart attack?
Risk factors? Of course, hypertension, well, yung smoking, avoid being obese, or if you're obese, you try to reduce your weight. reduce your cholesterol, reduce your, control your diabetes, and then having some physical activity. So those are the things that you do to control the risk factors. No? Avoid drugs, no? So because drugs contribute to heart disease also, even if the person is not basically hindi naman mataba or ano, but if he ingests drugs, he could have heart disease. Okay, so take note, ha?
Ang paano po nagtitrigger ng certain drugs po yung heart disease?
Because drugs can make your body function different. So you may have increase in your heart rate, increase metabolism or something like that. No? So your heart beats faster. So if your heart beats faster and then it has chemicals on it, so it triggers, it can trigger a heart attack. Okay.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function.
What causes blood clots?
Blood clots in what? In the brain? Or in general?
In general po.
Blood clots, it depends, no? So blood clots can be formed by, well, if you have an existing atherosclerosis or fatty deposits already in your blood, and then in your arteries, when it ruptures, it can rupture it because of the artery kasi is a dynamic thing, so it has a lot of movement, has a lot of blood flowing over it. So when it ruptures, the cholesterol deposits it develops blood clot inside. You can also have blood clot coming from from the heart, the inside of the heart. It can also circulate it to the body and deposit it in the different organs, especially the brain and the lungs. So, yun ang blood clots or embolism, no? Or those things.
Yung blood clots po, especially po, di ba pag sa stroke, sa brain, is there any way po na na-save yung patient?
The blood clots? Yeah, well, in the brain, we have what we call clot buster already na medication. So if the stroke there's a blood clot in the artery in the brain, in an acute setting, maano pa siya, bago pa lang, some people can give, in the emergency room, they can give anti-clotting medication for that, no? So, but in cases of very large strokes or something like late mo nang makatch sa emergency room, sometimes it's not given anymore. So you just treat whatever happens to the brain, so adjust or give medications to keep the brain functioning well. And then give also medications, tablets, which prevents other clots from happening. And also lowering cholesterol. Because cholesterol, if you lower cholesterol, it also decreases the chance of having cholesterol, further narrowing of the arteries, not only in the brain but also in your heart.
Even under physiological conditions, a small tear can appear in the wall of a blood vessel. In order to prevent blood loss, platelets and coagulation factors such as the pivotal factor 10, acting in a coordinated manner, close this wound. The platelets are responsible for a first sealing of the tear. Then, a number of coagulation factors are activated, leading to the formation of fibrin strands which stabilize the growing clot. These processes can also be triggered inappropriately and play a major role in the pathology of ACS, VTE, and AF. Thromboembolic disorders can affect both types of blood vessels. Arterial or white clots are primarily triggered by the rupture of an atherosclerotic plaque. Arterial clots are platelet-rich. Venous or red clots, on the other hand, mainly consist of red blood cells and fibrin. Vascular injury, hypercoagulability of the blood, and venous stasis play a crucial role in their development.
How common are strokes? Are they also hereditary?
Yes, of course. Strokes are also a form of disease of the circulatory system, but the stroke is the disease is confined to the brain. So you may have blocked arteries in your brain, or you have ruptured arteries in your brain. So they're also related to the circulatory system.
The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a clot, which blocks the blood supply, just like in a heart attack. This is why a stroke can be thought of as a brain attack. A clot may occur within the brain, or it can travel from another part of the body, commonly the blood vessels in the neck. Clots can also travel from the heart, which may happen when you have an irregular heartbeat called atrial fibrillation, or AF. If a blockage stroke is detected within the first few hours, a clot-busting medication is sometimes given to dissolve the clot. This is called thrombolysis. If thrombolysis can't be used, other medications such as aspirin will be given as treatment instead. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases.
Last question na lang po. What made you choose po yung cardiology and internal medicine?
What made me choose internal medicine? Well, internal medicine, I like to be treating people in front of me, something unlike other specialties. So internal medicine is a adult medicine. So internal medicine, pedia is for kids, no? So adult medicine is internal medicine. But I like cardiology, the field of cardiology, because my parents have heart disease. So that's what made me decide to go into the field of cardiology and internal medicine. And I want to interact with people. Unlike other specialties, where you don't interact too much with people, like what? Pathology, radiology, so those things. So I like more the clinical, when you have an interaction with the patient.
Fulfilling naman po.
Well, I think so. Oh, yeah. So, what's your course? You're not into medicine, ano? You're into Asian studies. So you will be lawyers.
Yes, po.
So, galingan nyo, don't be,